everybody, it's me, Wendy. I'm just going to do a quick update for you. It's Saturday, and I wanted to let you know that I went to see my hematologist yesterday, and we were discussing chemotherapy options. Well, no, not options, but treatment. And she did let me know that my MRI came back that my lymph nodes are clear. So that's awesome news. I'm really excited about that because that means that the disease hasn't spread anywhere else, just in my right breast. So my cancer chemotherapy plan is going to be 6 rounds of 4 different drugs once every 3 weeks. So I'll go in for about 6 hours with an infusion of the drug, then 3 weeks to recover, then back again for my next round for 6 treatments. Because I'm HER2 positive, one of the chemotherapy drugs that they'll be using is really hard on your heart. So I'm going to need to see a heart specialist to check my heart out and everything, make sure that it's good and healthy. And if not, you know, they need to find ways to make it healthy, or they're going to have to change my chemotherapy plan, treatment plan. But for right now, that's where we are on that. The other thing that she discussed with me was IV or port. So the positive thing about having an IV is, you know, they put it in, get your treatment, whip it out, you're done. 3 weeks later, put it in again, and so forth. So I don't have a problem with needles, so I could do that till the cows come home, but there is a higher risk of blood clots. So that kind of made me lean towards getting a port. It's surgical, and they'll place it, you know, somewhere in this area here. And then that way, when you go in for your chemo, they just pop it right through there. No need to try and find the vein or anything like that, and, you know, struggle with all that. So also, if you're afraid of needles, you don't like that, you know, maybe a port's for you. I opted for a port. So I'm gonna need to see a surgeon and handle that. She wants to start my treatment plan in 2 weeks. She also let me know that my hair is definitely gonna fall out. So say goodbye. I ordered a wig, a fun one, like a pinky kind of coral looking wig. I'm probably gonna get it later today from Amazon. And I got a head wrap, like a head wrap scarf. I like frilly kind of hanging things, so we'll see. I figured I'd have a little fun with it. Not that this is fun in any way, but, you know, just kind of play around with it, get comfortable with it. Just, you know, I'm trying to adapt here as best as I can. I'll also probably shave my hair down, maybe a military cut, get used to feeling the air on my skull to like transition. I used to have really long hair. It was down to my butt. And I donated my hair like 6 or 7, 8 years ago to Locks of Love. And they are a foundation that uses the hair that's donated to make human hair wigs for cancer patients. So if you ever, you know, do a dramatic cut, consider donating your hair, okay? I think it's a great organization that can help others with their self-esteem. Like I said, you know, this is gonna be really rough. I mean, when I was younger, I used to really care about my image and whatnot, but as I've grown older, it really doesn't affect me the same way. But I don't know, you know, just going bald and everything, you know, that kind of is like an attack on your womanhood, and, you know, that because for a lot of us, our hair kind of defines our personality and so forth. So it's rough for many, many women. I see many that are crying, and I don't know how I'm gonna react. But for now, I figured I'm gonna try and get comfortable with these things, the wigs, the scarves, the headbands, things like that. Get comfortable with them, and in that way, I'm hoping that it'll be an easier transition. So Monday, I'm gonna be talking to my surgeon, so I will follow up with you then. Until then, have a great weekend. Thank you so much for listening. Thanks for your prayers and your positive thoughts and everything like that. Click subscribe, follow me. If you have any comments you want to make, drop them down below. And till next time, see you then. Bye-bye.